This is the Physical Activity Researcher Podcast, a podcast for researchers of sedentary behavior, physical activity, and sports. Join for a relaxed dialogue about research design, practicalities, and, well, anything related to research. Learn from your fellow researchers useful and relevant information that does not fit into formal content and limited space of scientific publications. And here is your host, researcher and entrepreneur, Olli Tikkanen.
Welcome everyone. I'm very excited about the forthcoming episode as we are going to be talking about measurement of physical activity, differences between evaluation and research, and whether we should focus our research locally or globally, and also whether we should be more positive in our research communication. We will also touch upon the importance of teaching in academia. Our guest has done his PhD at University of Oxford about the validity and reliability of self-reported travel behaviour. Currently, he is working as a reader in physical activity for health at the University of Edinburgh. Ladies and gentlemen, I am honoured to introduce our guest, Dr. Paul Kelly. Welcome, Paul.
Thanks for having me, Olli.
Yeah, I can see that. So one thing you put in the notes before we started that we could discuss about our research communication, that should we be more positive in our research communications? Could you tell more about this?
Yeah, I mean it's a big interest of mine, Olli, and not just me, but colleagues from around the world. Is something that we talk about a lot, because much of the physical activity research can be characterized by talking about the bad things that will happen to you if you aren't sufficiently active. So there's lots of research around, risk of mortality or risk of diabetes or risk of cancer or risk of depression, the burden of inactivity. And I don't think we should stop doing that research, because it's clearly helped establish the field, right from the World Health Organization down to national and local governments. So I think it's important work. But I also, if you look at how, in general, in the broader society, people promote their product, if you will, or their services, they generally sell an idea of, look how good your life would be if only you would buy our car, our soft drink, our designer jeans, or whatever it might be. And, my assumption is that these companies have done quite a lot of research and spent quite a lot of money to figure out the most effective way of getting people to do the behavior they want. So it seems to me that there might be a big gap or a big opportunity in physical activity to complement the focus on burden with research that looks at the benefits of being active. And I'm not saying there's none of that, of course there is. But I think the weight and the kind of the narrative or the discourse in our field often focuses on, look how bad inactivity is. And I wonder if when we do our public communication, and our dissemination that's not meant for other scientists, but it's meant for the people who we are hopefully supporting to be more active, we could have a lot more work that's, look at the social benefits of being active. Did you know about the mood benefits of being active? Did you know about the energy and how you will feel and all of these, positives that we know there's, better evidence or good evidence for and getting better. So that's kind of the, I guess, what we're talking about when we say about the positives versus the negatives. And, it's led to kind of research projects around messaging and communication, which has been really interesting and has coincided nicely with the release of the updated, both the global physical activity recommendations and also here in the UK, the Chief Medical Officer recommendations. We're getting some good opportunities to feed into the communication strategies there and the messaging and to try and at least, get this idea of, can we talk about the positives, on the table as well as talking about the increased relative risk of type 2 diabetes if you are under the recommended activity levels.
Yeah, I fully see your point. Do you think it's in a way that researchers, when they, for example, make a grant application, they need to say how much does it cost now, and we could have cost savings. And then the researchers kind of get into this mode even when communicating to normal people, when it should be actually, you should think the whole thing again. How do we market this to people? How do we make them move? And kind of forget the way that we applied for funding.
Yeah, I think you might be onto something there, Ollie. You know, the grant funding bodies, obviously have a really important role in shaping the field and the sort of research that's done. And if there's a sense that they respond well to talking about the size of the problem, that would always reinforce us to think that that's the way to think and the way to speak and the way to communicate. And I don't know how to change this. I think it's important to talk about it and think about it. But you know, should we do our conferences where at least half of the sessions need to talk about the benefits as opposed to the harms? Or is it about us all agreeing that we need to have you know strategies and approaches that help us, like you say, shift that way of thinking when we stop talking to, maybe policymakers do want to know about the size and the cost of the problem,
Mm.
but maybe we need to be able to adapt to our audiences so that when we're then talking to the public or maybe to patient groups, we go to a different folder in our brains and and pull out some of the positive research which might resonate with them a bit more.
And isn't it that it's always just the other side of the coin? If you're talking about costs of inactivity, you could, in the same way, just talk about savings of being more active. That it's the same thing. It just depends which way you tell the story.
Absolutely. And I think there is there's some really good health economics that does talk about the value of activity. So some of your listeners might have heard of the health economic assessment tool, or the HEAT tool, and
Mm.
that for walking and cycling, and that's designed to give a value of walking and cycling as opposed to a cost of not doing it. And I think that's really helpful as a communication and an advocacy tool. And a couple of years ago in the UK, an economist called Simon French did a really interesting piece in a national newspaper around the personal economics of being physically active. And it's something that haven't seen in other places, but talking about how much we might benefit as individuals if we are having fewer sick days, if we are saving money by not driving because we're walking or we're cycling, all these sort of things, which might be really powerful arguments to the individual about their personal economic benefits of being more active.
So this personal economics, it was not your paper, but maybe you can tell what you remember. It sounds really interesting.
Yeah, not my paper at all. But it was just a kind of, and like I say, it was a newspaper article rather than a piece of research, and maybe it's a research gap that could be filled by one of the listeners. But it asked the question of what would be the personal economic impact of being more active, and it was things like savings on travel costs, be that train fares or driving. If you're able to walk or cycle at least some of the journey, is a gym subscription, is that net positive or net negative?
Mm.
And also how much value do we place on our health and our well-being and our mental health as we get older and as we move through the life stages? So if walking gives us opportunities to be more social with family and friends, what value do we put on that? And if by being more active, we're able to reduce our chances of illness and ill health in the future, is that going to save us money? Is that going to be something that we would value? And I just think these are really interesting ideas that I haven't personally seen explored in detail. And I hadn't thought of it as a research gap until you asked the question, but it does seem like something that'd be quite an interesting exploration to make.
Yeah, sounds really interesting and makes sense. And if we move to another team, global or local, what level do you think we should be doing our research? Where should we focus?
It kind of depends what you want to achieve, Ollie. If maybe to sound a little bit cynical, if you want to get published in high-ranking journals, go local. Go global. But if you want to do research that is going to be impactful, in terms of policymakers and practitioners being able to use it, then I think you need to go local, because it's that locally contextual information that is most useful to the people who are actually doing health promotion. And that's not a kind of casual observation from me. That's kind of well established in the kind of the literature around policy studies and knowledge transfer and implementation. And I think it becomes a challenge for our field, because you know, as you work in a university, your university will encourage you to publish in high-ranking, prestigious journals, and that would
Mm,
encourage you to do, a global analysis of one thing or another. But if you go and speak to, the local physical activity lead, maybe for your town or for your city, they want to know what should they deliver locally. It's all well and good telling me about, global statistics. That doesn't tell me what I should do about the problem. And it's a tension in physical activity research. I'm not sitting here, you know, uh, free of hypocrisy. Of course, I have done research at times which is at this global level. So it is a challenge, and I think it's something that I would like to see more of a conversation about, in our field, because at some point we actually need evidence on what to do, rather than just describing the scale or the size of the issue.
mm. And do you see a difference between global versus local and evaluation versus research? Is the other one more of either one?
Sorry, Ollie, I think it's a very difficult question, but I'm not quite sure I've understood it.
Yeah. I meant that is it if you're doing locally, is it
Mhm.
then more of evaluation, and if you do globally, is it more research, or is there a difference between these two?
I think you're right. I think there is likely to be a relationship in exactly that direction. That the more locally you're working, the more likely it is you're doing evaluation type work, and vice versa. I think that's correct. I don't think it has to be the case,
Hmm.
but I think there would be a pretty strong correlation as you've described.
Mm. And how do you see, like, for example, local research? Is it so local that it's a lot of different between, like, let's say, different in Edinburgh versus Glasgow? Or is it the same that if you find something in Edinburgh, it probably is similar in Glasgow? How do you see the differences or between different countries?
Yeah, I think there has to be some flexibility, and I think it depends a little bit on, or probably quite a lot on what it is you're looking at. What what factor or what determinant or what strategy. So to take your example of Edinburgh and Glasgow, there'd be some things which I think would be quite similar, because, for example, education policy and schools, and yeah, if we take that as an example, there's not gigantic differences, and therefore, you know, what you might choose to do in a Glasgow school might be important learning if it works for an Edinburgh school. But there are differences as well between the cities, in terms of city layouts and in terms of size. And, for example, it just so happens that Edinburgh has a much more extensive local bus network, which means that things that might work to stimulate public transport in Edinburgh may not transfer so well to Glasgow, just because of that contextual difference. So I think to answer your question, it would come down to context and come down to the specific research question in terms of exactly which scale is the most appropriate for the work you're doing.
Yeah, I can see that. And if we move to another team in a moment, do you have something to add more to this physical activity and global and local things?
Do I have anything to add? I'd be interested to know if people disagree. I'd be interested to know if people have found good solutions to this. I'm not sitting here, saying I'm right on this issue, but it seems to me to be a tension that is relevant to many of us, and that some dialogue and some conversations about it, I think, would be beneficial. So, I guess, what do I have to add? If you don't agree with me, get in touch and tell me where I've got it wrong.
Yeah, nice to hear comments from our listeners.
For most sedentary behaviour and physical activity researchers, collecting the research data is one of the most frustrating steps of a project. This is why we devised a revolutionary new way to collect data, introducing Fibion Sense Motion, the beginning of a new era. Fibion Sense Motion is a cutting-edge, next-generation system that allows you to easily and remotely collect, store, and manage data. Our solution features a tiny, waterproof device that captures the sedentary behaviour and physical activity data, a mobile app for automatic uploading of the data from the device, and a cloud service for managing the data. Even better, all collected data is GDPR compliant, and you have access to automatically analysed variables of activity types and raw 3-axis accelerometer data. Don't compromise on the quality of your research or the project timeframes. Discover the convenience and power behind our solution at sense.fibion.com. That is SENS.fibion.com. Fibion, created by researchers for researchers.
So we discussed global or local. Then if we discuss research or teaching and the importance of teaching in academia.
Yeah, I mean, again, something that's really important to me, Ollie, is the value that we place on teaching. And I've seen, many instances where researchers in our field feel that teaching is inferior to research, and that it's important to be a famous researcher, and if you're a teacher, then this signifies that you're in a different part of the food chain, and I'd really like to challenge those notions and push back against them. I was it probably 2018. I did a session at the Early Career network for ISPA, for the International Society of Physical Activity and Health, and I spoke about exactly this topic because there was clearly a sense that people who'd been asked to do teaching felt that it was detracting from their research, and that they didn't necessarily want to feel this way, but that there was this kind of second class kind of view of these things. And what I'm really keen to do is start that conversation around empowering people to see that teaching is complementary to research, and both should go hand in hand and be seen on equal footing. I think there's a couple of crucial arguments for that. One is that we need to see value in training the next generation of physical activity professionals, researchers, advocates, and that's done through our undergraduate and our MSc teaching. So not seeing, I think to not see value in those things, or to see them as purely supplementary activities, is going to limit the development of our field over the next 5, 10, 20 years. I also think that we should see teaching as a huge opportunity, because if I do a piece of research, I'm never sure how many people read it and whether it really changes anything. But if I teach a class of undergraduates, and let's say there's 20 of them, each year who are maybe sports scientists or are maybe medical students or are maybe physical education teachers. And I'm able to fundamentally change the way that they view the importance of physical activity and give them motivation and confidence to try and promote more physical activity. Even if it's only half the class, after 10 years, that's now a lot of people out in the real world who are, doing really important work in physical activity. And I think we don't value that impact anywhere near as much as we value a journal article, in a prestigious publication. So, I think talking about these things and seeing the value in teaching is super important. And I remember when I did this session, I left the group with a question, which is that we often talk about trying to influence policymakers and change the way they think. But
Mm.
if we can't change the way that a first year undergraduate thinks around evidence, or physical activity, or health, what makes us think that we can change the mind of a busy, important politician? So, there's really helpful training for us in terms of how do we construct arguments, how do we, be objective, how do we present our side of things, how do we learn to advocate for one or other side, and all of this stuff comes through teaching, through dialogue, through discourse. So that's kind of, I guess, my views on why there would be huge benefits to the field if we could place far more um, put teaching on the same footing as we put research.
I fully see your point. Maybe the problem is related to incentives. Like if you apply for a job in academia, basically you are asked about your publications, the quality of your publications, and then the teaching you need to just tell how many hours or how many years you have been teaching, which doesn't really tell much about the quality of your teaching. So basically, I think the incentives are wrong in academia between teaching and research. Do you see any way how we could improve the situation?
I think your comment is very insightful, Ollie, and I think in many cases is a big part of the explanation. I, I think if we, maybe if we take your example, and if you agree, if anyone who's listening agrees with what we're saying, then let's start by changing the order of questions in a job interview. Let's ask about teaching first, and let's not just ask about hours. Let's ask, what have you learned about teaching? Why do you think you're good at it? What do your students value? So, I think there's small things we could do. I mentioned conferences before. I'd love to see sessions in our international conferences, titled, what are the most effective teaching practices in physical activity and health? Maybe we should do keynotes which are around, the value of teaching and, teaching practices and things. So I'm sure there are things we could do to change the culture if we were motivated. But you're absolutely right. We also need to understand the incentives and the things that are out there, and if we ever get into positions to change those incentives, to feel that there's a rationale to do so.
Mm. And I think in the UK, there's sometimes the students are evaluating the lecturers. Am I right?
Yeah, we get annual student feedback and evaluations. That's correct.
Yeah, and that might maybe not go always the right way about quality of teaching. I think sometimes students are expecting that the lecturer is entertaining them, that it's entertaining, it's not boring to be in the lecture, and probably their evaluation is affected. How easy was it to pass the course? So how do you see this student evaluations of teaching?
Yeah, I don't know if it's the same for your listeners in different parts of the world, but yes, in the UK, we have student feedback, and student satisfaction is something that is drives a lot of policy decisions. And you're absolutely right that that can be another incentive to teach in a certain way or to examine in a certain way. Um, Personally, I think it's about expectation management. It's about treating the students, in a very fair way, in a very transparent way, and trying to include them in the educational process rather than, kind of see them as, just people who are passing through your university or your course. Um, I think it's helping them through that dialogue to see the value in what you're trying to achieve, in terms of learning outcomes, learning objectives, rather than, what was your exam mark at the end. Um, and, you know, but of course, all of that stuff, at the moment there's a danger that that's up to the individual to decide, how they go about that. And so, like I say, if we could have more discussion, discourse, dialogue within our field about, how we want to teach and be taught, then, I'm sure there's fantastic practices and examples already out there that would benefit all of us.
Mm. And do you see it's a problem that kind of market economy that the universities, they get more money, more students come in, and basically in some universities more students come when they can get the degree quite easily. So it's kind of different incentives for the university and education as a larger entity.
Yeah, I mean, like you say, Ollie, a mismatch of incentives is, always going to kind of create a challenge. Um, the I'm no expert on kind of the market forces or the market factors that and how they um, impact teaching and education and higher education. So I've got to acknowledge that, and I think it's about, you know understanding the situation and doing our best to work within it. There are, kind of financial and incentive and market factors at play in terms of physical activity levels. And, what we need to learn to do is how can we do the best physical activity promotion and support physical activity in the best ways, in acknowledgement of those factors, rather than sort of saying, we must change them, because I think we've got to be realistic about what is in and what isn't in kind of our control.
Yeah, I see that. And if we move to your upcoming research projects now, it's a little bit uncertain time in the world. Do you have some research projects coming up, or are they cancelled due to the pandemic?
Um, yeah, a kind of a mixture. We certainly a lot of our research went online in March. So many things which were planned, for example, to be face-to-face qualitative interviews became online video um, interviews, and I think we were very fortunate that we were able to continue that work, um, and actually in some ways we found recruitment a little bit easier. People seemed, are slightly more willing to give up their time to do a video interview than, come and meet face to face. So there was that was quite fortunate. Um, the kind of the two projects that come to mind where we just got quite fortunate with the timing. So we've done an evaluation in Edinburgh of the so we had 20 mile an hour or 30 kilometer per hour speed limits came in sort of 2016 over a couple of years. And we've been evaluating the impact on driving speed, driving behavior, injuries, collisions, casualties, and ultimately, whether people feel that it's more walkable and more cyclable. And we're very fortunate that we'd finished data collection. So actually, the last 3 or 4 months have been an opportunity to sit down and analyze those data and write the papers. And we just kind of got lucky that it didn't happen halfway through data collection or something. And then at the other end, we're just starting a project on the provision of e-bikes for people who've been recently diagnosed with colorectal cancer. So this is a project where there's a sense that if people can do some physical activity immediately before they have surgery, and then also in the recovery phase, that might be beneficial to them. So this project was obviously meant to start in the early summer. It got postponed, but now as there's an increased focus on trying to start up the other aspects of our healthcare systems that kind of went very quiet during the emergency response. We've got this opportunity now to see if how many people are interested and how do they use the bikes, and ultimately, do they perceive a beneficial impact on their health.
And you mentioned this study about the speed limits. Do you have already some preliminary results you could share with us?
Yes. So speeds did change. Speeds went down over a 12-month period by about 1.3 miles per hour. Now, that doesn't sound like a huge reduction because the speed limit had changed by 10 miles per hour. But the modeling and the kind of existing evidence shows that for every half a mile an hour reduction in speed, you can get a 5% reduction in mortality. So that is a really important finding. And I think the reason for this, and I believe it's work by a researcher called Elvik, is it's about the distribution of the speeds. So a car that used to go at 24 miles per hour going at 22.7 miles per hour, doesn't doesn't have a huge measurable impact. But that change in the distribution also represents a car that was maybe going at 41 miles per hour going to 34 miles per hour. You have a biggest effect on the highest speed, and of course, what happens there is fatal accidents become serious. Fatal collisions become serious collisions, and serious collisions become minor collisions, and minor collisions become near misses. And this is why you see that kind of large, excuse me, public health effect on what looks like quite a small change in the average speed.
So did I understand correctly that the highest speeds will come down when you limit the speed?
That seems to be what happens. Yes, it's the kind of the 80th percentile, or those top speeds. It's the right hand or the right hand side of the distribution curve is where you get the shift to the left. And as you say, this seems to be what drives the reductions in casualties and fatalities.
That's an interesting finding, and I think important also in that way. Do you have any other preliminary results that you would like to share?
I don't think I can tell you anything else because I don't know the analysis well enough. I know that so I'm leading the paper on speeds. There's a paper on collisions and casualties that is the analysis is almost complete, but I don't know the findings yet. There's a paper on livability. So what to what extent has the area become more walkable, more cyclable, more livable? And there's also perceptions work on the residents. Do they feel more safe? Do they feel more likely to walk or cycle? And as I say, very soon the results will be available from those. But unfortunately, I can't share any findings yet with your listeners because I haven't read the papers.
Yeah, no problem at all. So you are doing interesting project. Is there some kind of collaboration you would like to have that could maybe take your work to the next level?
Oh, you mean kind of wider collaboration with researchers in the field?
Yeah, there might be some listeners who could be interested collaborating. So what could you be looking for, if any?
It's an interesting question. I suppose anything around evaluation methods and approaches is always a conversation that I'm keen to have. I suppose, as I said earlier, anything around the teaching and learning in physical activity, and if people are interested in this idea of the positive side, the positive aspects and angles. Again, that's something that would really always enjoy those conversations. Uh, if you're interested in e-bikes, it'd be great to get in touch. I probably don't want to give too long of a list, but I think hopefully that's some ideas for people to think about.
Yeah, I think it gave. So it's been really interesting discussions. Is there something you would like to bring up still into the discussion, or what are your final remarks for this episode?
No, I think we covered some topics which I find really interesting. Thank you for inviting me to come on and have these discussions. And if any listeners have made it this far, thanks for listening. And like I say, always keen to chat on social media or email. If people think they can see holes in my arguments or better ways of putting it, then I'd really like to have those conversations.
Great. It was great to have you in the show. So thank you, Paul.
Thanks, Ollie. Great to be here.
Thanks for joining us this week on Physical Activity Researcher Podcast. If you like the show, make sure you never miss an episode by subscribing or following the show on Twitter. This podcast is made possible by listeners like you. Thank you for your support. If you found value in the show, we would really appreciate a rating on Apple Podcast or whichever app you're using. Or if you would, in a real old school way, simply tell a friend about the show. It would be a great help for us. We have a fantastic lineup of guests for forthcoming episodes, so be sure to tune in. Thank you all for your support and have a great day.